Okay, we're back from the break. Thank you again for tuning in. And I want to remind our viewing audience that the call-in number is 727-8750. That is 727-8750. And if there's any topic you have, any question, please feel free to call in. Try and answer any question I can. And like I said, even Ray, the flagman, has asked some very interesting questions, some of which I don't know the answers to, but I do endeavor to research those so that I can better respond to that on the next show. At any rate, getting back to blood pressure, which we're discussing tonight, I want to reiterate that one of the things that happens in a doctor's office when you do get your blood pressure, it's kind of like being pulled over by the police, although not quite as a nerve-wracking situation. But white coat hypertension, if you've not heard of it, is a condition that really does exist. And what that basically is that it's a stressful situation coming into the doctor's office. So we can see anywhere from a 10 to 15 millimeter increase, and sometimes much higher in some people that get their blood pressure checked, and we usually will let them sit for a few minutes before and they have a chance to calm down, and then we can recheck their blood pressure, certainly if it is aberrant from normally. So that's why it's important that you do check your blood pressure in that right time and do it almost at the same time. Now, for those people that take blood pressure pills, depending on the timing of your blood pressure pills, it's important to check your blood pressure within 30 minutes to an hour afterwards. You might see the greatest effect of that, but then you can follow it up. If you do ever check your blood pressure and it is elevated, please make sure you are checking your blood pressure again. Now, I do not like the wrist model. I do not like the finger models. They are further away from the circulation of your heart and are more prone to give inaccurate readings. And if you're not sure about the device you have purchased or are attempting to purchase, make sure that you do the gold standard, and that is take it to your doctor's office so that blood pressure device which you are using is being calibrated against the gold standard, which is the audible pressure cuff that we are listening to your pulse as it comes out. Nicotine raises blood pressure, so if you're a smoker and you go into the doctor's office, you should not have any nicotine in your system an hour prior to having your blood pressure checked. And that's true if you're checking it at home and you're a smoker. Alcohol raises blood pressure. More than 2 drinks will elevate it. 2 ounces of alcohol will raise your blood pressure. So people say, oh, well, I'll take a couple drinks and relax. Well, yeah, you may feel relaxed, but your blood pressure will not be normal. It causes a flushing situation and does elevate your blood pressure. And prolonged alcohol use will cause a cardiomyopathy or congestive heart failure related to that. So I've always said moderation is the key. So if you drink too much, then you might suffer a lot of other consequences other than elevated blood pressure. Okay, let's go to the slide I have put together, which is going to, I listed several different, there are 2 types of blood pressure. One of them is what we call primary or essential hypertension. It affects 90 to 95% of the hypertension diagnosis that we see. And the secondary hypertension is from 5 to 10% of the population. Both, again, have the same values as being abnormal, and I say above 160. Part of that is as you get older, they've redefined the blood pressure for the elderly patient. In your 40s to 50s, 135 to 140 is a decent blood pressure. As you get up to age 65, 160 could be normal depending on the situation. Greater than 160 would be abnormal. The reason for this is that lowering blood pressure too low in the elderly population is a higher risk for falls, a higher risk for life-ending events, meaning the cure could be worse than the disease. If we lower your blood pressure and let's say into the 120 range, and it takes usually 1 prescription for every 10 millimeters of mercury over 130. That being said, if your blood pressure is 160, it might take 3 pills to get you 3 different medications to get your blood pressure down 30 points. And is it that effective in what we're trying to prevent, which are the long-term consequences of blood pressure? So if you've made it to your 60s and 70s and have not had a heart attack, have not had a stroke, there may be no significant benefit to lowering your blood pressure lower than 140, 150 range. You're going to prevent strokes, because what happens in strokes is that when blood pressure is that it's the rate of change. So if you're in the 120 to 130 range and all of a sudden your blood pressure goes up to 220, that's a 100 millimeter increase, and that could significantly cause blood pressure. But sustained blood pressure over time causes what we call a lacunar infarct. It basically is narrowing the blood vessel over time, and eventually it chokes itself off. So sustained hypertension, even though when you're young, can cause some problems as you get older, you may need that pressure to perfuse your brain, and therefore lowering your blood pressure too low could be as disastrous as having high blood pressure. So this is subject you'll want to bring up with your healthcare provider to talk about your blood pressure values. But don't get excited if your blood pressure is 140 over 80 or 140 over whatever the number is and think that you have hypertension, because that would be no longer the case. So make sure that you are doing that. Both blood pressures, again, we have the same treatment goals as the slide dictates. And again, what I talked about was different disease states, different things can help modify or determine that you need a range, and that needs to be decided with you and your provider. And again, with regards to essential hypertension, there is a little bit of a known cause, but with secondary hypertension, there are indeed causes, and we will go with that into the next slide. One of the reasons we like to treat blood pressure, obviously, is preventable risk for premature death, and by controlling your blood pressure, we do increase the risk. By not controlling your blood pressure, you have an increased risk for ischemic heart disease. That would be a heart attack or angina, and an increased risk for stroke, obviously, peripheral arterial disease. Again, if your blood pressure is maintained for a prolonged period of time, your blood vessels are going to narrow, they're going to harden, they're going to cause an increased resistance, which would lead to a heart failure. Your heart is very interesting in that if it is one of the organs that fills from the outside. So as blood vessels, as in your colon and all these organs, they do this. The blood vessels that feed that organ are on the outside. So the only time your heart fills with blood or feeds its muscle is in the resting phase of the heart. So as it beats and contracts, it squeezes off its blood flow, and as it opens up and fills with blood, it also feeds itself. If you were to start with a 5-pound weight and lift it up every day doing curl exercises, and then you started with 10, and then you went to 20, and then you went to 40, then your muscle would increase in size, muscle hypertrophy, and your heart will do the same thing. And there's a condition known as left ventricular hypertrophy, which is a thickness in the wall of that. So you can see that as blood pressure maintains itself for a long period of time, the heart will thicken, and it becomes harder to fill during rest. And eventually it can cause congestive heart failure by killing and wiping out the inside of your heart tissue. So that's why this is why it can cause a heart failure. Aneurysms are basically pockets in your blood vessels, meaning they're out-pocketings, and they also have a risk of bleeding. If you get one in your brain, it can cause death. If you get one in your abdomen, it can cause death, depending on how big it is. And this is the other one that's kind of new, but it is cognitive impairment and dementia. It is felt that elevated blood pressures in your 30s and 40s, and maybe even into your 50s, is causing a diminution in your brain function and your brain tissue by what they call microvascular disease. So it's very important to get your blood pressure checked and make sure that it is well controlled to help maybe prevent that particular issue. Chronic kidney disease, probably a big reason a lot of people are on dialysis today. The kidneys really are a very important organ in the maintaining of blood pressure. And for some reason, if they aren't filtering very well. They have this renin-angiotensin system, which is very complex, but they don't have eyes to the outside world. And if you get dehydrated, they try to maintain your volume of distribution. They elevate your blood pressure because they were meant to be a survival mechanism when we were much more primitive than we are today, to get us from one watering hole to the next or for periods of drought. And that being said, there are certain conditions as we live longer that could mimic that. One of those is called renal artery stenosis. And what that means is the renal artery that feeds our kidneys may develop atherosclerotic disease. If it develops a plaque and limits the blood flow going to that kidney, then what ends up happening is you get this spike in your blood pressure because your kidney thinks that for some reason you're dehydrated, and it wants to maintain your blood pressure so that you don't fall down from weakness and dehydration, but you're not dehydrated. So this is one of those survival mechanisms that can be run amok, so to say, and can work against us. So if you're having a hard time controlling your blood pressure and you're probably in that atherosclerotic disease in the 60s, one of those causes is secondary hypertension would be renal artery stenosis. And then obviously retinal issues, which is blood pressure does affect the blood vessels to the eye and can be a cause of retinal bleeds and amyloid deposits, which is diabetes. But if you have diabetes and high blood pressure together, you have a real fire and gasoline situation developing in your circulatory system, where you're very more likely to get heart disease. You have now 2 risk factors for heart disease, 2 risk factors for stroke, 2 risk factors for all these other issues. And so it's a very dangerous situation. Throw on that a little alcohol and a little cigarettes, and you're really walking around with a loaded .38 pointed at your head. We're going to be going to break in just a few minutes, and then we'll come back and we'll be talking a little bit more about this essential hypertension and peripheral resistance, and then this very important formula which you'll see in here, which is called isolated systolic hypertension. It's very complex, and I want to take some time to discuss that with you. It's a very important phenomenon that I've been alluding to, that as we get older, our blood vessels become less expansible. They're stiff. And what this formula is basically velocity equals the cube root of the diameter of the pipe. So what that means is that if you have to get, let's say, a gallon of fluid through a hose, and you decrease the diameter of the hose by 1/2, you actually have to force the fluid 8 times as fast to get that same volume through that pipe in the same time. So that's why when you're young, your blood vessels can expand, and as they do, it can account for the extra volume. But as you get older, your blood vessels, through aging and atherosclerosis, become stiffer. So the blood vessels cannot expand like they once did. So small volume changes can make huge differences in our blood pressure. And so that's why the most common treatment for blood pressure is still a diuretic or a water pill to help reduce some of that volume in your system. It's a very important phenomenon, and this is why I alluded to watching the systolic, or the upper number in your blood pressure as you get older. Don't worry about the diastolic. That really doesn't matter very much at all. It's just that top number, because again, it's the head of pressure, it's the volume that needs to go through your blood vessel. Anyway, that's a very complex subject, so we're going to come back from break, and I'm going to go over that again. And Pahrump, thank you for tuning in tonight, and still need a call. Thank you.